Here to talk about a big pain that he actually hears a lot about is Dr. Doug Yeatman from Ascend Pain Institute. Good to see you, doctor.
Hi, nice to be back.
Always great to have you. Now, this is one of those things that is often misdiagnosed, you say, and it's very, very common, and it hurts. It's a big pain, right?
Correct. It's a big pain in the butt.
It's called SI pain.
SI joint. It's the biggest.
Okay.
I got a little model here we'll show, so
Okay.
everyone understands what we're talking about. So this is the spine.
Okay.
So when your hips are called ischial, that's the eye, your spine comes down to the big section, lower part, that's your sacrum. So they connect the SI joint. Okay. It's one of the bigger joints. I'll flip it to the front here.
Okay.
It's one of the bigger joints in the body, but it doesn't move. It sort of flexes. It's more of a shock absorber.
Okay.
So people get pain in this area. They sort of notice they can't sit in a chair, always lean to one side.
Okay.
As it gets worse, it'll start radiating down the leg, mimicking a pinched nerve. And so, of course, they get all these workups, MRIs. Well, you don't have a pinched nerve. You must be crazy.
Right. And you start feeling like you are crazy. You
Exactly.
know?
But it's pretty common. It's one of the more common pains people have. Most people know it during pregnancy, especially women. Toward the end of pregnancy, you get the hormones start relaxing ligaments and things. Well, your pelvis starts moving more.
Okay.
Well, it becomes painful. That's where you get that lower back, lower seat area pain just before you deliver. It's very common. Other common problems are people who've had hip replacements, trauma in the legs, get one leg longer than the other, you limp. Well, every time you take a step, your whole body weight goes on one joint than the other, so you start irritating one side, and you get that irritated joint, and it goes down the leg, is common. And then, of course, the other ones are psoriatic arthritis. One of the first symptoms you have is SI joint pain.
Okay.
You have severe psoriasis everywhere. Rheumatoid arthritis gets it quite often. And just regular old general arthritis can get it. But that's the one, it's just sort of people, I just got this pain, and just ignore it. So the best way to figure it out is actually, see a doctor. If you don't have pain down if you do have pain down your legs, you don't have a pinched nerve, well then it's like, okay, what else is it? And then you start looking at other things. The common one is an SI joint. That's very common.
And what do you do? Somebody comes to you, and that's what you guys are all about, is you don't necessarily have to live with this pain. There are so many different ways that you can help alleviate it. So what would you do for somebody who came to you with that type of pain?
Well, the first thing that we do to test, make sure we think that's what it is. Everything else is negative. So then you say, okay, well, we'll diagnose it. The diagnosis, you numb the joint and make it go away. If it goes away, guess what? That's it.
Okay.
And then we also throw a little steroid and bring swelling down, just like a bad knee, you bring it down. Then you also have physical therapy, chiropractic, do exercises, give you home exercise to keep muscles and ligaments stretched. Sometimes it goes away, sometimes you repeat it, it goes away. Some people have such bad arthritis that it only works a short time. Then you start saying, okay, now we need to fuse it. There's different ways to fuse it they have with surgeons. One way they used to do is put pins and rods and bolts and stuff. And now they have a very minimally invasive pin system that goes right through and fuses it, which is very quick and easy.
Interesting. And working, a lot of success stories?
Oh yeah, it works great. A lot of my patients the symptoms start coming up their leg and my butt cheek's starting a little sore, and they'll call and say, yeah, I need another one shot. And it's usually because they had a bad hip, or they've been limping for years, or had back surgery. That's another one, fused backs, so you walk differently. So it's very common. So we just put the fire out and keep them going.
And that's what you guys are all about, from this type of pain to all sorts of different types of pains. You don't necessarily have to live with it. There's so many different ways that Dr. Yeatman and his team can make you feel better, correct?
Yes, there is.
All right, and get in touch with him if you've got that aching pain that just doesn't seem to go away. There is something that he can do to help you out. Good to see you, as always.
Good to be here. Thanks.
Thank you.